The last question. A 62-year-old woman presents to the clinic with complaints of a worsening rash on her back, fever, chills, and rigors for 2 days. She denies any headache, nausea, or vomiting. She is currently on chemotherapy for multiple myeloma, which was diagnosed last year. On examination, there are multiple punched out ulcers covered in crusts surrounded by raised biliaceous margins on her back. Some of the lesions have black necrotic centers. The vital signs include temperature 102.0 Fahrenheit, respiratory rate is 24, pulse rate is 110, blood pressure 100 by 90. Lab studies show hemoglobin 8.4, WBC is 1500, platelets are 3 lakh. Which of the following is the most likely organism responsible for this patient's condition? Option A, Pseudomonas. Option B, Staphylococcus aureus. Option C, Streptococcus pneumonia. Option D, H. influenza. And option E is Streptococcus pyogenes. All right. So this is a 62-year-old woman who comes with a worsening rash, right? And she has fever, chills, and rigor, which is not very significant. But then she's on chemotherapy, which when they are referring to chemotherapy for multiple myeloma and all this stuff, they're basically trying to tell you there's an immunocompromised patient. And now when you come down to the description of the rash present on her, they are basically punched out ulcers in crust surrounded by raised biliaceous margins on her back, and they have black necrotic centers. All right. So when this is very particular for ecthyema gangrenosum, which is caused by Pseudomonas aeruginosa. All right. And how it is referring to, it is usually present in immunocompromised or diabetic. Diabetics also come in immunocompromised state only. Oh, so okay, so chemotherapy and diabetics and all that stuff, they are referring to this as black necrotic centers or ulcers, which is referred to as ecthyema gangrenosum. All right, is it clear? And then the drugs for Pseudomonas. Would anybody like to give me a quick list before I explain it? I'll write a mnemonic which is also there in your first aid. So I have written it from there only. But yes, you need to know all the drugs involved in this. It is very important and high yield. Okay. So yes, I'm getting answers. So let's deal with it. So this is carbapenems. Okay. Next. Very good. Aminoglycosides. Then monobactams. All right. Then yes, piperacillin. Then fluoroquinolones. Then we have third and fourth generation cephalosporins. All right. And then we have extended spectrum penicillins. Okay. Extended penicillins. All right. I'll repeat it. Carbapenems, aminoglycosides, monobactams, piperacillin, fluoroquinone, third and fourth generation cephalosporins, and extended spectrum penicillin, which is your piperacillin and all, right? Okay, these are the main things which you need to know in this question. All right, and other than that, ecthyema gangrenosum is a summary of this question, which is mainly found in immunocompromised patients, as mentioned over here. All right. And if you want to come to the mechanism of action, basically it is the exotoxin A which contains elastase in it, which leads to the degradation of elastin. All right, which leads to elastin degradation, and then it will lead to ulcer formation. All right. And then you have other toxins also, as mentioned here. So the exotoxin A, basically it inhibits protein synthesis, and it also contains elastase, which degrades your elastin in the connective tissue. All right. Then we have pyocyanin, a pigment produced by the Pseudomonas aeruginosa that produces reactive oxygen species toxic to the cells. Okay. Then we have phospholipase C, which breaks down cell membrane phospholipids, leading to further tissue damage. All right. So these are the different toxins in your Pseudomonas, and I will repeat it again. Exotoxin A, which inhibits protein synthesis. Then exotoxin A has elastase, which degrades elastin in the connective tissue. Then you have pyocyanin, which leads to reactive oxygen species formation in the cells, and then you have phospholipase C, which breaks down the cell membrane phospholipids, leading to further tissue damage. All right, am I clear to everyone now?
Thanks for watching. Please give a thumbs up and subscribe for more.